Acute kidney injury. Sudden reduction of the renal function is called acute kidney injury. It is manifested by decreased urine output in good amount of time. And if it is last longer, you have the raised serum creatinine in the blood. So, and then you have, if it goes beyond, you have edema, hypertension, your respiratory distress, and features of infection, and uremia, nausea, vomiting, anorexia. So don't go that far. When a child your doesn't pass urine following diarrhea or fever or any other volume loss like blood, plasma, and your third spacing like edematostyle, nephrotic syndrome, cirrhosis, and malnutrition, and others, you have the decreased urine output, you have raised creatinine in AKI is a very strong diagnosis over here. We do intervene earlier because late diagnosis, late intervention would give rise to the late one or poor outcome. So, 60% of cases are of pre-renal AKI, hypovolemia, by blood loss, plasma loss, and your serum loss. Another 30% or so is due to the renal disease. These children has proteinuria, hematuria, your hypertension, and renal impairment features like your nausea, vomiting, anorexia, growth failure, and so on. And in acute cases, they may not have the growth failure, acidosis, so and they do have infection. And another 5 to 10% cases, you have obstructive uropathy. These children has obstructive uropathy syndrome, lower tract symptoms like frequency, urgency, hesitancy, unable to evacuate the bladder in full, and your full bladder, and your failure to feel the fullness of bladder, both. And finally, on palpation, there is tender enlarged kidney on and bladder. So, and features of UTI. How do you intervene? Here, the volume loss cases should be replaced volume in ml by ml. In the GN cases, intrinsic renal disease, they are to be treated in their own fashion, standard fashion. PSGN should have the diuretics, antihypertensive, and wait for the eventual recovery. The C3GP, US prednisolone and MMF, AJ vasculitis, yes, again prednisolone, MMF, and cyclophosphamide, and your rituximab, and lupus nephritis in its own way, the prednisolone, cyclophosphamide, MMF, and hydroxychloroquine. Obstructive uropathy, they do need referral to a surgeon. So early intervention of the post-renal cases is very important. They are common in the developing nations. The disease is quite high and quite severe, causing loss of life. Even, in fact, 13.3 billion population of the globe have this mishap, and 1.7 million loss of life annually is taking place throughout the globe, and more disease load in the developing nations like lower middle income countries. So urine output monitoring and avoiding dehydration, avoiding the hypotension, and taking care of those cases earlier, and appropriate treatment of GN obstructive uropathy can have some impact on the better outcome of the disease.